Do you know the difference between a doctor and a nurse? It's a question many ponder, yet the answer isn't as simple as it seems. Today we're setting out to explore these two vital roles in healthcare, each carrying their unique responsibilities and both undeniably critical in maintaining the health and well-being of patients worldwide. Doctors and nurses are two sides of the same coin, working in tandem to provide comprehensive care. But what sets them apart? What are the particular roles they play within the healthcare system? And how do their responsibilities intersect and diverge? Well, isn't that a fascinating journey to embark on? We're about to dissect the roles, responsibilities, and the very essence of what it means to be a doctor and a nurse. It's a voyage into the heart of the healthcare system, and it promises to be as enlightening as it is engaging. So buckle up. Stick around as we delve into the exciting world of medicine. First off, let's focus on the role of a doctor. When you think of a doctor, what comes to mind? A white coat, a stethoscope, a reassuring presence? Yes, all these are true, but a doctor's role goes beyond these symbols. Doctors are the primary healthcare providers, often the first point of contact when we fall ill. They're the detectives of the medical world, using their keen observation skills, knowledge, and experience to diagnose a wide range of illnesses. But they don't just stop at identifying what's wrong. They also develop treatment plans tailored to each patient's unique needs, which can include prescribing medication, recommending lifestyle changes, or even performing surgeries. But becoming a doctor isn't a walk in the park. It requires years of rigorous education and training. After 4 years of undergraduate study, there is another 4 years of medical school, followed by 3 to 7 years of residency training depending on the chosen specialty. Yes, you heard it right, 7 years. And that's not even counting any additional fellowships for those who decide to super specialize. Speaking of specialization, that's another key aspect of a doctor's role. Medicine is a vast field, with over 100 different specialties and subspecialties. From cardiology, dealing with heart issues, to neurology, focusing on the nervous system, to psychiatry, addressing mental health. Each doctor has their own area of expertise. This allows them to provide the best possible care, backed by in-depth knowledge of their specific field. It's also worth mentioning that a doctor's role extends beyond the physical. They're confidants, counselors, and sometimes even shoulders to cry on. They provide reassurance in times of uncertainty, comfort in times of distress, and hope when things seem bleak. In essence, they play a crucial role not just in treating illnesses, but in promoting overall health and well-being. So that's a brief overview of a doctor's role. Now let's move on to nurses. Now, let's shift gears and talk about the role of a nurse. Nursing is a profession that is both art and science. It's a blend of caring and curing, of compassion and clinical knowledge. At its core, nursing is about patient care. Nurses are the ones who spend the most time with patients, monitoring their condition, providing comfort, and often being the first to notice any changes in a patient's health. A nurse's role extends beyond bedside care. They are also responsible for administering medication, following the instructions of the prescribing physician. This requires precision, as any mistake can have serious consequences. They also assist doctors during medical procedures, ensuring everything runs smoothly. But the role of a nurse doesn't stop there. They are educators, teaching patients about their conditions and how to manage them. They are advocates, standing up for their patients' rights and needs. And they are counselors, providing emotional support to patients and their families during difficult times. Becoming a nurse requires specialized education. The most common pathway is to earn a Bachelor of Science in Nursing degree, but there are also associate degrees and diploma programs. Once their education is complete, aspiring nurses must pass a licensing exam to practice. And like doctors, nurses can also specialize in different areas. From pediatrics to geriatrics, from critical care to community health, the field of nursing is vast and varied. Each specialty requires additional education and certification, allowing nurses to deepen their knowledge and skills in a particular area. So, while doctors and nurses both work in healthcare, their roles are distinct. Doctors may diagnose and treat, but it's the nurses who provide the continuous care and monitoring that is essential to patient recovery. They are the heart and soul of healthcare, the ones who ensure patients are not only cared for, but also heard, understood, and respected. So, that's a quick look at a nurse's role. But how do these two roles differ? Now that we have a basic understanding of both roles, let's compare them. When we look at the roles of doctors and nurses, we can see that they both play critical parts in patient care. but their responsibilities and areas of expertise are distributed differently. Doctors are typically responsible for diagnosing illnesses, prescribing treatments, and overseeing patient care. They are decision makers, and they usually work on a more strategic, macro level. Nurses, on the other hand, often work on a more micro level. They are the ones who are there for the patients around the clock, monitoring their conditions, administering medications, and providing emotional support. They act as the eyes and ears of the doctors, often being the first to notice changes in a patient's condition. In terms of education, doctors require a significantly longer commitment. After obtaining an undergraduate degree, aspiring doctors must attend medical school for 4 years, followed by a residency program that can last anywhere from 3 to 7 years. In total, it can take over a decade of education and training to become a fully licensed doctor. Nurses, however, have a more varied educational path. Some nurses start their careers with a 2-year associate degree, while others opt for a 4-year bachelor's degree. Additional education and certifications can lead to advanced practice roles, like nurse practitioners, who can diagnose illnesses and prescribe medication much like doctors. Despite the differences in their roles in education, doctors and nurses are heavily interdependent. A doctor's diagnosis can only be as good as the information they receive, and that often comes from the keen observations of nurses. Similarly, a nurse's care plan is guided by the doctor's diagnosis and treatment plan. This interdependence is mirrored in their responsibilities too. While doctors carry the weight of making critical decisions about a patient's health, nurses are responsible for executing many aspects of that plan. They ensure that the doctor's orders are carried out correctly and that the patient's needs are met in between doctor visits. And let's not forget the emotional aspect. Nurses often spend more time with patients than doctors do, providing comfort and assurance in addition to physical care. This emotional support can greatly enhance a patient's well-being and recovery. Doctors, while perhaps having less direct contact, also play a crucial role in guiding patients through their health journey, explaining complex medical conditions and treatment options. The takeaway here is that while doctors and nurses have different roles, education, and responsibilities, they are both vital to the functioning of the healthcare system. They each bring unique skills and perspectives that, when combined, provide comprehensive care to patients. As you can see, while they have different roles, both doctors and nurses are integral to the healthcare system. You might have heard some common misconceptions about doctors and nurses. Let's start with doctors. One common fallacy is that all doctors are wealthy. While it's true that doctors often earn a good income, it's important to remember that they also face high costs for education and training, and often carry substantial student loan debt. Not all doctors are swimming in cash, as the stereotype suggests. Another misconception is that doctors always know best. While they are highly trained and knowledgeable, medicine is a vast field. No doctor knows everything. They often need to consult with peers, conduct further research, or refer patients to specialists. It's a collaborative effort. On the other side of the coin, let's talk about nurses. A common misconception is that nurses are just doctors' helpers. This couldn't be further from the truth. Nurses are highly trained professionals who play a critical role in patient care. They not only assist doctors, but also make independent decisions and provide a range of services, from administering medication to educating patients about their health. Another misconception is that nursing is a woman's profession. This stereotype has been perpetuated by pop culture and historical gender roles, but the reality is that men make up a growing portion of the nursing workforce. Nursing is a challenging and rewarding career for people of all genders. Lastly, some people might think that being a doctor is more prestigious than being a nurse. This is a subjective viewpoint. Both roles require extensive education, dedication, and skill. They are different, yet equally important in the healthcare ecosystem. A doctor's work would be impossible without the support of nurses and vice versa. It's crucial to understand that these professions are not in competition, but rather, they complement each other. They each bring unique perspectives and skills to patient care. They often work together as a team, each contributing their expertise to achieve the common goal of patient health and well-being. Hopefully, we've cleared up some misconceptions about these two professions. Teamwork makes the dream work, and it's no different in healthcare. In the world of healthcare, teamwork is not just a nice-to-have, it's a must-have. It's the bedrock that holds the entire healthcare system together. More than just a group of individuals working together, it's about creating a cohesive unit that operates like a well-oiled machine. where each cog, be it doctors, nurses, or other healthcare professionals, plays an essential role in maintaining and improving patient health. Picture this. A patient comes into a hospital with a complex medical condition. The doctor diagnoses the problem and sets up a treatment plan, but that is just one piece of the puzzle. It's the nurses who are often the ones executing this plan, monitoring the patient's progress and making necessary adjustments. They are the ones who spend the most time with the patient, understanding their needs, fears, and hopes. They are the eyes and ears of the healthcare team, providing crucial insights that can significantly impact the course of treatment. But it goes beyond just doctors and nurses. Everyone involved in patient care, from the lab technicians who run the tests, to the pharmacists who dispense the medications, from the therapists who help rehabilitate the patient, to the administrative staff who ensure a smooth hospital experience. They all contribute to the patient's well-being. Each of them brings a unique perspective and set of skills to the table. When they work together, sharing information and collaborating on decisions, they can provide the best possible care. Teamwork in healthcare also fosters a culture of learning. With so many different professionals involved, there's a constant exchange of knowledge and ideas. This cross-pollination can lead to innovative solutions to complex problems, improving the quality of care and patient outcomes. Moreover, teamwork helps to reduce errors in healthcare. When everyone is working together, communicating effectively, and double-checking each other's work, the likelihood of mistakes decreases. It creates a safety net, ensuring that nothing falls through the cracks. But perhaps most importantly, teamwork in healthcare humanizes the medical process. It reminds us that behind every medical chart, there's a person, a human being with fears, hopes, and dreams. It's not just about treating the disease, it's about caring for the person. And that's something that no one can do alone. It takes a team. So the next time you walk into a hospital or a clinic, remember this. It's not just the doctor or the nurse who's taking care of you. It's a whole team of dedicated professionals, all working together for your health and well-being. So, while they have different roles, doctors and nurses work together to keep us healthy. To wrap up, let's summarize what we've learned today. We've dived deep into the world of healthcare, and more specifically, into the roles of doctors and nurses. We've seen that doctors are highly trained professionals who diagnose illnesses, prescribe treatments, and manage overall patient care. Their extensive education and training make them experts in their respective fields, and their decisions often have a significant impact on a patient's health. Nurses, on the other hand, are the backbone of the healthcare system. They provide care to patients on a more personal level, often being the first point of contact. From administering medications and monitoring vital signs to providing emotional support and educating patients about their health, nurses play a multifaceted role that is equally as important as the role of a doctor. That brings us to the differences between these two professions. While both are integral to the healthcare system, their roles are distinct. Doctors focus on diagnosing and treating illnesses, while nurses focus on patient care and recovery. This differentiation is crucial in ensuring that patients receive comprehensive care. We also debunked common misconceptions, such as the idea that nurses are merely assistants to doctors. We've learned that nurses have their own unique set of responsibilities, and their role is not lesser or subordinate to that of doctors. Finally, we discussed the importance of teamwork in healthcare. Doctors and nurses work together, each bringing their own expertise to the table to provide the best possible care for their patients. They collaborate and communicate effectively, forming a strong healthcare team that is capable of tackling any health issue that comes their way. In conclusion, whether diagnosing illnesses or providing patient care, both doctors and nurses play essential roles in the healthcare system. The interplay between these two professions is what makes the healthcare system function effectively, ensuring that every patient receives the care they need and deserve.